Well, I am delighted to have Kyrah be our guest this month. I've known Kyrah since she just started in graduate school at Wichita State, and she has sparkled in all the years I've known her. She'll tell you more about her professional route, because that's what the discussion is going to be about. But she went from graduate school to a postdoc in the local health department, then to a private consulting firm in Texas, and now at a academic position that's part community work in a public health program. She'll tell you that route, but I think what's most interesting is going to be to watch as she describes the balance between practice and academia and academic functions like research and writing as she sorted it out, because I think it's a fascinating issue. And I'm sorry we don't have more of the early career people here for it, because I think a lot of people face it. So Kyrah, I'm going to turn it over to you, and if other people come on board, we'll get them to say hi later.
Okay, great. Thank you, Tom. So I guess to align with the agenda, I was just going to provide an overview of a very brief kind of overview of my own trajectory, because I think, especially knowing a few of you who are on the call and knowing your own kind of paths and those who are way more seasoned, and I think that it helps kind of get a sense of what can be, because I know that's something that just throughout the years that I kind of struggle back and forth with, is kind of reminding myself that sometimes you have to create those spaces or navigate your career in a way that maybe most people don't realize that you can. So I think starting from the beginning will kind of give some insight into where I've landed. But when I was an undergraduate student, psychology student at Spelman College, I loved psychology, but I knew I didn't want to go into counseling or clinical psychology. And I'd never heard of this thing called community psychology until Morehouse, which is right next door to Spelman. I was actually a community psychologist. Dr. Sinead Young was teaching intro to community psych. And that's how I became introduced and fell in love with community psychology. And later, like my senior year, I joined the practice council and was able to kind of get involved and learn more about this wonderful field of community psychology and all these great people who were doing just such amazing work. And so I think that really opened up several opportunities to meet faculty at community psychology departments, because at that time I was looking at graduate school, and I was kind of a perfect alignment because, like I said, I knew I didn't want to go into a clinical kind of track. And so I ended up applying to several programs, but accepted at Wichita State University, where I worked with Dr. Rhonda Lewis and Greg Nyson. And it was such a rich environment of master's and PhD level community psychologists. I think when I think about kind of my time in Texas and in Wichita, everybody knew about community psychology. And Nicole, I don't know if you had that same experience, but most of the time engaging with community members, you'd say, I'm a community psychologist and this is what this means. And they're like, oh yeah, I know what that is. And so
that's unique to Wichita.
It is. It was so amazing. And I think that made the work all the more better that, the community had a kind of an awareness of that because of just the history of community psychologists in Wichita and the work that they were doing. And so I was able to really engage in a lot of community-based research and really evaluation within working with different community partners. And so I think that's where kind of that love for and for me, perceived need to know how to work side by side with community agencies to engage in research. So, having that kind of that criteria first to engage in any work, because that tended to be just kind of part of the process. So when I was getting ready to prepare for graduation from graduate school, again came a similar dilemma that I faced at the end of my undergraduate career, which was, I'm looking for postdoctoral fellowships, and my interest is maternal and child health, and a lot of that tends to be very, epidemiological focused, and that's interesting to me, but I really wanted to be in a space where I could be engaged in the community while also doing the research and the work. And so for a while I was really scared. I was like, I don't know what my next steps are. I don't know what's gonna happen. And I'll speak to this in a moment, but what ended up happening was a colleague and friend of mine, fellow community psychologist, Giovanna Merriman, she was actually working at the Sedgwick County Health Department. And through her help, and then WSU faculty and the KU School of Medicine, which is right next door to Sedgwick County Public Health, I had the opportunity to put together a proposal for my postdoctoral fellowship to kind of create that through an academic public health partnership between those two institutions. It was a very unique, I think, process, and I'm very grateful for it because I was housed at the health department, but I received research mentorship through KU, which was right next door. So I was able to work with what we call our internal customers, or the Sedgwick County Health Department staff, and really get into the work of evaluation, capacity building, and kind of developing trainings for those public health professionals who were going out doing the work. I was able to really get involved with a lot of coalitions in town and kind of build that research piece into that. So it was a really great situation, and I probably would have stayed in that position forever, except for my now Texas. So I had to get to Texas. So I did have to leave, but I think it really gave me a taste of, oh wow, this can work. Like I can have both. If I could just find another situation that allowed for that. So upon my transition to Texas, with the help of Susan Wolf, who was working at a nonprofit management organization, I started on as an evaluation consultant with that organization, providing third-party evaluation and just kind of evaluation capacity building, building logic models, and just helping inform program development and evaluation with nonprofits. And while Susan and I were there together, I think it was a really exciting time because there were different, even though we were doing consulting, there were different projects that we were able to work on. And so Susan, I think I give a lot of kudos to Susan because, we really were trying to, let's publish this work, let's make it known kind of what we're doing, because it was some innovative work that we felt like we could share and publish that information and present at conferences. So I think there was that other piece of, here we are engaged in this evaluation practice, but still finding ways to disseminate that information in a way that contributes to the field, but it also contributes to the local community. And I think that went well for some time, but I think one of the things that happens, the challenges that happens is in those particular situations, producing scholarly information isn't necessarily the priority. and it's something that may not necessarily be valued, no matter maybe how many times you try to kind of pitch it, especially when the priorities shift and the climate shifts in those types of situations. And that'll be something that I revisit too when we talk about kind of lessons learned. But it was, I think, a challenging time because, you know, what's the point of doing great work when you can't share that with others so that they could try to implement that and improve their situations in their respective communities. And I think that was one of the kind of roadblocks that, again, it was a challenge, but it made me realize that this was something that was really important to me, that I wanted to do. And so during my 2 years at this consulting firm, I was still engaged or writing up my research, like previous work that I'd been doing at the health department and some dissertation work in the evenings and at night. And I know Susan put me in on some work that she was doing. And so we were able to just kind of continue writing outside of work and publishing, whether it was a blog or it was a conference abstract or what have you. We tried to make sure that we stayed active. And so after quite a while, I was ready to kind of move on because, like I mentioned, the climate had changed and the priority wasn't, it just shifted to something that I felt like it was a space where I couldn't necessarily grow. And so after a lot of rejections, a lot of late nights putting in applications and more rejections and and a few crying nights, I moved to the point where I was making a lot of cold calls and kind of reaching out. And thankfully, I reached out to a clinical faculty member at University of Texas at Arlington. And we met in Starbucks, and I told her about my background in evaluation practice and community psychology. And she'd never heard of community psychology. She's actually an MPH or DRPH and an MPH. That's public health, Masters of Public Health. And she loved community psychology. It's like, you know, we're starting this public health program. We really believe in this thing that you call community psychology. I think it aligns with everything that we're trying to do for our students, and really give those students who will be the future public health professionals the skills that they need to go into the community and carry the torch. And so, kind of long story short, she walked with me through that entire kind of interview and application process, and I ended up getting the position. And I was just so happy because I think the moment I stepped on to UTA's campus, actually part of UTA's mission is carrying community engagement. So there's really this culture of, yes, we need to be embedded within our neighboring communities, and we need to be able to use our skills and resources to support. And so I felt like this was a really great opportunity to merge my work because, I mean, my area is maternal and infant mortality. And yes, there's the kind of research side of it with, you know, that kind of epidemiology focus of, you know, the risk factors, all that thing, but I have to be in the community as well, especially a new community like North Texas. And I felt like I was supported in being able to do that. So a lot of what I've been trying to do since my time here at UTA is building those relationships so that students can have the opportunity to learn how to work with community members, period, and learn how to work with them with providing that kind of capacity building with evaluation, not necessarily research. You know, there are some, you know, times when I do focus on research, but really my emphasis has been program evaluation because I really feel like that's kind of that connecting point in terms of how communities identify their needs. They need to know if their programs are working. They have questions about their programs. So I really I'm trying to embed myself within the community to do that. So I've been here since September. So and my husband reminds me, Kyrah, you've only been there for 3 months. So, you know, it's okay. Like you're not. So, but it feels like time has just flown, and I'm just so excited about just getting to work and learning who the community is and everything. So that's kind of a broad overview of kind of the points where I've been. So, and I didn't mention, like, right after graduate school, I was doing some evaluation work at a couple of different nonprofits. So, you know, I've been felt like kind of all over the place in little kind of nugget areas, but that's kind of that cycle that I think has come about from that, was just being able to know people and people who can help me navigate that process. So I guess I'll pause for a second before I jump into kind of some general reflections and lessons learned based on that trajectory, and just pause and see if anybody has any question or comment.
I would just comment, because it makes it all more human and real, that when you said you had to get to Texas, it's because your future husband was there. And that drives, I mean, you know, you skip over it, but it drives our lives, that we go for our family lives as well. And you had to get down there, and we, you know, all helped you find a way. Great fit. But.
Well, and I have sort of a similar situation, but in reverse. So I'm not geographically mobile because my husband is here and can't or won't move. So it's a similar situation, and it does drive a lot of choices in that area. And so if you feel trapped because you're not rewarded for the things that help you move to a different domain, that can be really tricky. That's hard.
It is. And it was really hard too, because, you know, after the move and after being at that firm, you know, public health anything other than biomedical, I think, work in North Texas is very, I don't want to say scarce, but it was very hard to find. There's a really heavy biomedical kind of focus and just focus on other things. So when I was starting to look at jobs, I was getting really scared, to the point where I was like sending emails to like hospital systems, clinics, saying, here's what I can do for you. I see that you don't have a position for this, but let me make up a position and see if you need it. Because it was just really hard. I know Susan can attest to that, kind of the landscape of public health, community health. Like that was just it was weird.
Yeah, and I've been stuck here more or less since 1989 trying to eke out a career, and it's not easy. If you're not geographically mobile, it can be very difficult.
Well, you know, there are a couple of pieces to this that are interesting. One is that community psychology makes a lot of assumptions about a commitment to community and to social action that is not embraced by almost anybody else in the world in any field. Yeah. So when you go hunting, that's something you face. But you said something very interesting even about the Wichita Health Department job, which was that you created it. You made this marriage of an academic and health department. And I wrote the first chapter in the first handbook on community psychology about careers in community psychology. And I picked 5 people to write who are pretty well known. And as I read their stories, the thing that was common is each of them had created that job. They had not applied for a job called creative community psychologist. They applied for a job that was something else. They'd created it, and they all had to fess up, and this was a long time ago, and hopefully it's changed a little, that their colleagues didn't even know they were community psychologists. So the path you're describing is an old one. It's getting better, but whether you're in Texas or somewhere else, these jobs are often created as opposed to formed for you.
Yeah, and I think that's so important, especially as an early career person, because you're told, or you tend to be told, that this is the path, whatever this is. And when the this meaning the reality doesn't quite match what the said path is, you know, it can be very disempowering until you realize, yeah, okay, we got to do something. We got to create something. We got to, you know, and I think that's probably been one of my biggest lessons, is remembering to step back and kind of think outside the box with regard to that. And I think in line with kind of thinking outside of the box, I mean, I think I don't think I would have made it without having such great examples and mentors. And I know, Tom, we were talking a little bit earlier about this kind of, you know, what is practice? What is academia? What is, you know, that in the research sense? And I know that there's always, I always had this fear of, you know, will I be able to go back into academia or at university? But I think being able to work on publications, whether it's peer reviewed or, like I said, any type of scholarly product, right? While in my job that was not in an academic setting, I think in seeing others like Tom, Susan, I know Jessica Drum, and just others who have been in non-academic settings continue to push the field forward with their work that's coming out of from the ground, right, from the community. And I think that was a big eye opener for me. And I know, you know, with working with Susan, you know, she'd always say, let's you know, let's see how we can publish this. Let's see how we can disseminate this information. And I think having that voice always helped with even getting the job at UTA. I mean, even though it is very focused on community engagement and is supportive of me being nested within the community, I still have to have publications and I still have to show my scholarly record. And I think it was because of that that I was able to. So I think that's one point of, if you are kind of navigating that and maybe you're not sure where you want to land, make sure you still keep both of those skills of, you know, producing scholarly information or scholarly products while kind of navigating your career. Because like you mentioned, Tom, I mean, you have just as many publications as, you know, someone at whatever university. And I think the difference is the accessibility of that information. And I think that's important.
I want to, this is Gloria Levin. I want to add something that I don't want people to go away with the idea that if you're in practice, you can't disseminate information widely, that the only way of doing that is through publications.
Yeah.
I am a lifetime practitioner, have not done since graduate school in the mid-70s, have not done a bit of academic work. And maybe you and Susan and maybe some others can talk about the venue of the American Evaluation Association as an alternate way of disseminating the good work that you're doing in the field.
Yeah, I think, thank you, Gloria. And I think that's such a great point, because I think engaging in that process kind of rocked my world. Because you're right, like it's, publications, but I think because while I was at the nonprofit firm, I became more involved with the American Evaluation Association, and even just the process of, you know, publishing information through blogs that's sponsored by AEA, or presenting information through, or, you know, I'll use Susan's example, presenting information through like their e-studies and trainings, and just that, you know, just all these other mediums through which information can be shared, even at the local level of producing briefs and you know, trying to send that out to the community. I think and Susan, feel free to, you know, speak on the, like the second half of that. But I think that part is what I try to infuse and keep now that I am at UTA as well, because I feel like it's been an enhancement, because you know, but it's also been, I've had to play the role of educator for those who only see this is what scholarly, you know, productivity looks like, right? It looks like peer-reviewed publications. But having to educate my peers and even local community, like, look, no, we can, these are other ways that we can disseminate this information and you actually put it to use. And I found myself having to become kind of an educator in that process. And maybe sometimes change people's minds about what that looks like.
Well, you know, I heard in your describing your work at the health department that you would learn things that you wanted to disseminate because they were of value to people in the field.
Mm-hmm.
And that is such, I mean, that really captures the nugget of it that we don't talk about. It's sort of, well, practitioners also publish. Well, it's because, you know, you discover something about working with young moms that you want other people working in African-American communities to know about. So how are we going to get to them? Not AJCP. You know, they'll never read it. So you have to think about how do you get the word out. So I love that motivation from you. And I don't think we do enough in training the more than 50% of the graduates who go into practice, that's a valuable impulse to pursue. So I loved the description of it.
I think it's this is Nicole. I think it's useful too to think about teaching skills that recognize newsworthiness. Mm-hmm. So it's a journalistic skill. It can be learned, but it doesn't, you do need to have sort of this idea and this recognition that something or other is newsworthy and is worth, you know, either talking to a local publication or talking to another publication. I think a challenge that we have at the Center for Applied Research and Evaluation is many of our partners don't necessarily want the results of their evaluation disseminated. Mm-hmm. And so a lot of times we may do a really great evaluation and they would rather keep that close to the vest and not tell people about it for a variety of reasons. And it doesn't have anything to do with the outcome, summative or otherwise. But it could have something to do with their, you know, their populations feeling vulnerable or what have you. And so I think practitioners also have to sort of walk that line to try and find the things that are both newsworthy and that their partners feel comfortable talking about. Because one thing that I know I've heard in the past is there are community partners who feel very much like there is this PhD or this educated person who swoops in, collects a whole bunch of data, swoops out, publishes, and then they never hear from them again. Right. And that, I think, is something we fight very hard against. And it's important, I think, to make sure, and we reiterate to especially folks who are just emerging into early career, it's not all just about getting the data and getting it published in whatever way you want to get it published. And I think that that's an important part too.
Yeah, absolutely.
One of the things that I think works well, and this is why I love AEA, is if you do a really great evaluation and use all really great methods, you can go and present it at AEA because you don't have to mention the client or anything else. You can kind of just talk about the design, the methods, and that. You don't have to share results or anything. So those are some ways to be able to share kind of too, and that helps a lot. But you're right. As a consultant, people are always asking for samples of work, and some of my best work, I can't share it. It's proprietary, and I have to tell them, you're not getting my best because I can't share that. Yeah. Just like I would keep yours confidential. Right. So that's an interesting practice issue.
I think raising the question about how do we train graduate students to disseminate? Well, we train them to write a thesis, and we train them to publish an AJCP. At least when I wrote my thesis, they after we had this long initial document, they said it had to be 30 pages long at the end so it could be actually published as an article. That was at least useful, but it was still aimed at getting it to be an article. I'm doing training with the Healthy Wisconsin Leadership Institute, and they train each team in media. And how do you put out a little film about your program? And how do you tell the story about it? And a lot of it is about storytelling. And it seems to me that would be a useful skill for someone who's going to practice. Because as you said, Nicole, it's about being media savvy.
Yeah, and the reporting style we use, there's things like flipping reports where you start with, you know, some results, but you do a lot of pictures and very brief. The headings are typically can be finding statements or something like that with just a graph or something. So the reporting style in practice is, you know, so much different than what you would do.
Yeah, and I think those are all great example of things that you learn only through practice. You know, you do it, maybe you fail or maybe you succeed or what have you, but you learn it through that process. And I'm so excited. So in the spring, I'm going to be teaching program planning evaluation. And one of the things that I pitched to them was, look, you know, I've done this. You know, it's more than just teaching this. I've been in the field. I know what works. And so I know it's my own kind of professional and personal mission with that class is to structure it like, you know, how do you, almost kind of like evaluation consulting, like that's kind of the approach that I'm taking with it, of how do you work with community members to design an evaluation, implement it, disseminate it. Let's talk about, okay, there's theory to it, but what does practice look like? And you need to know both of those skills so that you go, once you graduate from here, you know how to kind of effectively engage and do that. But, and I wanted to mention, and I think it's kind of the glorious point, and Susan, what you mentioned about AEA, I think about the you know, the presentation that we did. And of course, most of the folks in the room were, you know, maybe professional. Some were maybe in nonprofit world, but when we presented on a project that we had done while at the firm, we talked about the elements of the work, because that's kind of the most important piece is, you know, what did we do? How well did it work? And what are some ways that you can maybe adapt this in your work, right? And so whether that's at AEA or at a coalition meeting, I mean, I think that's still this dissemination of work that informs practice.
Mm-hmm.
Are some of the other people on the call wanting to hop in here and make a comment? Susan, Nicole, and I are pretty aggressive in getting in, so we'll pause for a moment and give you a chance to ask questions of Kyrah or comment.
Rami, can you hear me?
A little louder.
Okay.
We're getting some sound, Rami.
Can you hear me now?
Yep.
Okay. It's interesting that you mentioned concerning the communication of
We're losing you. We lost you. Can't hear you, Rami.
sense with different views. How can you reach them the most accessible way? And what tools do we need to get to that point? And while I'm doing so, I found myself that, let's say I want to use social media or like create a website, I had to learn these kind of skills myself. Concerning whether we want to create a video, we have to learn a little bit about the idea of how to edit them and how to use multiple means to deliver that kind of messaging, from reporting or articles or videos or even like blogging online. So I found myself while doing this thesis, even though that wasn't my main target, that I had to learn all these new skills in order for me to be able to actually reach out to different folks from different areas. Mm-hmm. So it's just nice to hear that kind of, like, I guess everybody's doing the same thing and trying to go into like different means to reach out to people.
Yeah.
Just a thought.
Yeah.
Kyrah, you want to go on to some of your other learnings? I know you had a couple.
Sure. Yeah. I guess one of the others was something I mentioned before, which was having mentors who are practitioners in non-academic settings, as well as those who maybe consider themselves pracademics, or, you know, who are also practitioners but work in academic settings, however you identify. But I think having a balance of that and kind of a community of that, I know that I feel like that's worked very well for me, because it just helps see the full picture and see those possibilities that maybe you wouldn't otherwise see. I think that's something that's been very, very true and salient from my own experience. I think this is something that kind of Susan and I go talk about a lot, and that is, you know, although in retrospect, I'm not sure how much of a difference doing this would have made, just because of kind of the cultural climate of the organization. But I think if you know, going into a practice position or a non-academic position, but maybe you are interested in disseminating what I'll just call scholarly information, you know, through whatever medium, but doing something additional to kind of the work that you're doing, is trying to be as clear as possible up front about what you're asking for. I know when I accepted that position, I did kind of talk briefly and maybe even, you know, oh, I'm interested in, you know, maybe writing up about the projects that we do, but I think it was still very vague. So, you know, if it's clear that you want to be able to go to a conference and share the work that you're doing in this agency, then say that. If you want to publish work either through blogs, white papers, journal articles, whatever, say that up front and kind of negotiate that. I think that's something that, you know, if I ever get into a non-academic setting, I feel like I have a clearer sense of the types of activities that I'd still like to be able to do. And so can we talk about that? Can we talk about your, so that there is a balance? And I feel like I'm still doing something that's meaningful to me and still engaged as a scholar as well.
Yeah, I would agree with that about being very upfront that you need time to write for publishing and that you need time. But I think we ran into a special barrier, and that the person that hired her really wanted things to be out there, but then she suddenly became afraid that if they were out there, people would steal them. So she you know, after we got out there and we're ready to, you know, show things at conference, it was like, never mind, we don't want this out there because people will steal it. So it was kind of a weird situation, probably not common, but I think you have to be really explicit and really specific that you need to be able to do these things and get that in writing.
Mm-hmm.
Well, I'll give you, go ahead, I'm sorry, respond. Kyrah, you want to respond to that?
Oh, I was just agreeing.
When I was first starting to work, I was a clinician, and I was trying to carve out time to do community mental health work on a college campus. And after my first job, where they said you could do that, but then when I got there, I could only do it after the waiting list ended, right? The waiting list at the Student Mental Health Center never ends. The next job, I got it in writing, that 50% of my time was to do community work on the campus. And if I hadn't had it in writing, they would have eaten me alive, as would my colleagues, because they would say, "Where are you going, Tom?" So it's a really good and important lesson.
It is. And I think once you kind of see that in retrospect too, I don't know about others who maybe identify as early career, but sometimes having that confidence to say what you need. I know I struggle with that sometimes, but I think through this experience, I've had greater confidence in doing that because I know the ramifications of not getting, you know, what is fulfilling or what I feel like I need to be able to do to feel fulfilled.
you need that unhappy moment to come to the realization that if they don't want to give me the job so I can do what I want, I'm better off not getting it than doing it.
Yeah.
It requires having some scars.
Yes. Yes, indeed. So I think just to kind of recap, having a diverse range of mentors and peers who you can talk to that are in multiple settings to kind of navigate that, knowing that there's multiple ways that you can create opportunities to be a scholar, that scholarship isn't defined by one thing, and that there's usually going to be people who are willing to collaborate with you and support that, and that it is possible. And then being clear, if you are navigating in spaces that are non-academic and even in academic settings, I had to be very explicit. Look, practice, being engaged with the community is very important. And it's still an education piece because, we're in the Department of Kinesiology. These are science people who don't know community psychology, let alone public health. So there's a process of educating on both ends that you're just gonna have to accept that role and push forward with it. So yeah, I think those are kind of the main pieces that have kind of resonated with me. And I know we had some questions, and some of it's kind of bubbled out, but for those who are on the call that maybe haven't said anything just yet, or just kind of thinking about the conversation, what stage are you in your career, and what challenges or supports have you encountered while maybe trying to balance or pursue a career in a practice setting or academic setting?
Great. So let's open it up to the people we haven't heard from yet. 312-732.
Hey, Tom, I just want to let everyone know that we're going to be doing a webinar in February on how to get your work published in media outlets. And we're very excited by it. It's a woman from Boston College who was actually working for the Archdiocese during the movie Hotshot. Is that what it was called? The one about the Spotlight, right. She was working for Spotlight at the time for the Archdiocese, and she was the person who had to negotiate that relationship with the media. And since then, she's a social worker and an activist, and she's done a lot of work with a lot of media outlets around the world. So we're really excited about that, and we'll be getting an announcement out about that soon.
Great.
That's great.
I have a question of Kyrah. Kyrah, this is Gloria. What in the short time you've been in academia, what has surprised you about the differences in the rewards that you get in practice versus an academic setting? Like, what's valued of the work that you do?
I think so. I guess the most ready example is, so I think here the common, I think, understanding is that research with application equals translational research, or research that automatically informs the community just because it's maybe applied, right? And so I see a lot of kind of support of that. And I don't know if I think it's just because of maybe awareness, but in practice setting, I think I tended to see more, how do I say this? Like obviously the work that's being done, but then the benefit or the results that arise out of that work to truly make a change. And so I think one of the things that I'm going to have to navigate is publicizing that work that's being done in addition to kind of the benefits of it. And that being something that's, I think, not many people understand. I don't know if I'm making sense, but it's still something that I'm still kind of working through in my head, but almost like that immediate gratification. Oh, there's a study done on this, and it's, we don't know if it's worked or, it's just, or if it's going to even impact the community. Yes, it has implications for the community, but will it work? Can it be translated? And I feel like here at the university, sometimes we're a little stuck there because we don't understand all that goes into what it takes to actually provoke change in a community setting. Does that make sense, Gloria?
Mm-hmm.
Yeah, it makes a lot of sense.
Okay.
And do you notice that the prestige that you carry with coming from an academic setting has any currency more so than with a doctorate in a nonprofit entrepreneurial setting?
I think somewhat, yeah. I think people maybe tend to take me more seriously because of maybe and I think I understand what you're asking, but because of the name associated with just UTA, and it's like, oh, he's a researcher at UTA, whereas working in the community, yes. Once people saw like my bio and I told them kind of my skill set, then there was some buy-in. It still took a while because just historically we think about universities and just what that means, and that it automatically qualifies somebody to be high quality when in reality it doesn't always. That's not always the case. So
I think you'll run across 50% of the people in the community who will say, oh, here's another academic. How are they going to rip me off?
Yeah.
I mean, I think there's been so much of that there's a huge, especially in communities of color where I've worked. We worked in Holyoke, which is right in the middle of 5 colleges around here. And there's such caution about the interns and the faculties who come because it's not clear what they get back.
Yeah.
So I think it works 2 ways. It can open the door, but they can also, the people who've been around a while can say, oh, I know them.
And honestly, I think one of the hard parts that I've been dealing with is the like paid work. So being a consultant, you can set your rates and make sure it's affordable, but I've been getting used to kind of the whole different budgeting scheme and how that works on the academic side. And I can't say that I like it too much because it can get on the pricey side. I don't like to do that. So still figuring that out. But that was just a really big change for me.
Doesn't it mean you have to charge more because the university takes half? Is that what you're?
Yeah, like for certain things, yes, but like having to incorporate the percentage effort and that sort of thing, yeah.
Yeah. So we've got about 5 minutes left, and I'd love to get some assessment of this call before we're done. Anybody who's been quiet with a question you're dying to ask? Tiffany's on.
Yeah, I have a question if we have a little time. Hi, everybody. Hi, Kyrah. I wondered if you went back to your educational setting, your training, what would you change about that experience that would have made you better prepared to balance being a community-based practitioner and making some type of scholarly contribution, be it peer review, online presence with professional organizations? What would you change?
I think more opportunities to disseminate information in ways other than peer-reviewed publications, budgeting and kind of forecasting the work, I think I really hone those skills in practice that have just prepared me for future wherever I go. But yeah, I think diverse dissemination and publication, being able to budget, forecast projects, knowing all that it takes to implement a project in a community setting, start to finish. Yeah.
Great question, great answer.
Thank you.
Because National Lewis is a program, you know, working with practitioners and training practitioners. The question is, what do they need to know, and where does the dissemination go?
Mm-hmm.
You want to respond to that, Tiffany, or did you?
Well, no. I mean, I'm always looking for ways to adjust what we're doing. We have a lot of flexibility, so you know, if you know, writing a class paper seems kind of silly, but you know, writing a blog or creating a website that's going to start you to get that online presence, or you know, we're trying to be more innovative and sort of getting people more tech oriented and getting connected to professional organizations in a way that's more efficient and useful for them. And so yeah, so
like an e-portfolio, or I know that's something that we're working on, is like e-portfolios, and that way students can come up with their skills and products and that sort of thing.
I think one of the other questions is, who are we supposed to be disseminating to?
Right.
And, you know, when I look back at my career, we're in the American College Health Association Journal, the Journal of Personnel and Guidance, because I was working in student mental health, and that's where they were, even though AJCP was around. And then when I was doing stuff in the community, it was in the National Civic Review, and in the Municipal Advocate, which is a city thing. But if you're doing healthy communities, you want the mayor. I think we have to be thinking about where are the audiences that we want to get to.
And Tom, you might want to mention that you and Dave, some other people have your own, I don't know what you call them, blogs or newsletters, or that's the opportunity where you build an email list of people who are interested in your work and come out periodically with your thoughts on work that you're doing.
Well, and I think
it's able to write your thoughts without anybody having to edit them.
Yeah. I also think it's important to understand you will have to cultivate multiple audiences.
Great.
I mean, you have to cultivate that anyway, so.
Sarah, you want to say hi? Were you going to?
Hi, I'm so sorry. I'm eating lunch.
Oh, I thought you had a question. Well, we're delighted. We had a dozen people on with all kinds of questions. Kyrah, you were a knockout, both in terms of the story you told and the issues you raised. For me, and I said it to Kyrah earlier, it really raises the question, what really is the difference between practitioners and academics? If we take a look at what Kyrah's been talking about as a dissemination responsibility in a practitioner, then the lines start to disappear in a very interesting kind of way. Next month on December 14th, a Friday at noon, Can Lee from Community Science is going to talk, and I've asked her to talk about health equity and health disparities, not from a theoretical point of view, but from the actual work that she does. There's an awful lot of people who write about it. There are very few people who write about doing it, and Kian is one of them. And then in January, Nuria Chiafalo from Pacifica has just written a book with indigenous people from a pretty remote part of Mexico that she's been working with for 8 years. And they wrote a book together that looks like it's going to be published. So that process should also be, and the work and the process should be fascinating. So I hope you join us for those dates. Any quick feedback on this working for people? I loved it. I thought you were terrific. That's what I thought. Thank you all. I know there's maybe another call at 1. Jean has recorded this, so it'll be on YouTube for those who missed it. And thank you so much, Kyrah, for the preparation and the presentation.
Thank you.
Take care, everybody.
Thank you.
Bye.
Everybody.
Bye.
Thank you.